Okay, perfect. So now we're starting. Hello, everyone. Thank you so much for tuning in for Lamsa's Wednesday webinars. I'm really sorry for that happening, but electricity went off. There's no internet connection and my laptop is not connecting. So I'm really sorry for that. Yeah, it's too much. And I'm really happy you tuned in for this topic because it's very dear to my heart. We will tackle today together suicide prevention. And this is the topic that introduced me to mental health after one of my colleagues died after a fatal suicide attempt. So basically that's when it triggered me and I started to search deeper into mental health. And I'm really happy that we can discuss this topic together. And I'm happier because I have my friend Alfred with us today. So I will be introducing him. This is Alfred. Okay, I'm not seeing the PowerPoint anymore. I hope that you're seeing Alfred's picture. So Alfred is a medical student. He's a sixth year medical student or a MD student. Okay, did it work? In the English system. And also he's a mental health advocate. Am I the one who's lagging or is it you?
Alfred, your voice is lagging.
Okay, not mine. Okay. So now Alfred
Let me just okay, I'm supposed to 3G, so Wi-Fi about how can طفي الواي-فاي.
Okay, so while you're working on that, I'll keep on introducing you. Is it okay? Okay. You're muted.
Can you hear me now? Is it better?
Yes, no, it's better.
Life in Lebanon, a lovely scenario. Yes.
Perfect. So I was saying that Alfred is a medical student. He's a Mat 3 student according to the American classification. He's also a mental health advocate. He's been advocating for mental health for almost 5 years now. And for me, he's literally a walking mental health encyclopedia. So whatever you want to know about, whatever question you have in mind, he always has an answer. So you'll see. You'll see. And what I would really also love to say is that Alfred is now seeking his diploma in organization of mental health services. So he's really very passionate about mental health. Is there anything that you would like to say about yourself before starting?
I think that covers it. Yani. I'm just a mental health nerd. So
yes, exactly. Okay. So what we will be doing today is it's like an interview-based process. So I'm going to ask a question. Alfred will answer it. If you have any questions, if you would like to comment on that, if you have any further things that you want clarification about, you just can type it in chat. Or if it's like a very important question for you, you can unmute yourself and just ask it to Alfred directly. And we're going to start. The first question is...
Please feel free to ask as much questions as you want.
Yes. Yes, that's important. Okay, so the first question is, when talking about suicide, what should we say and what should not be said in this matter?
So essentially suicide is a very sensitive topic. Sometimes we use a bit of very outdated words to describe it. So the most commonly and the one that I hate the most is committing suicide. So and this stems from previously when suicide, and sometimes some certain countries in this era يعني, that criminalize suicide. So essentially commit suicide is it's like saying I always go back to physical health and say have you ever heard someone commit a heart attack? Have you ever heard someone commit a hip fracture? I don't know. So in the same way, no one commits suicide. It should not be a legal issue. It's a health issue. It's a mental health issue. And what proper terminology we use is someone died by suicide. So someone ended their own life. Sort of how we say someone died from a heart attack, not someone committed a heart attack. So I love really this analogy. Other stuff is like saying this is a successful suicide attempt, this is a failed suicide attempt, and really it puts the connotation on failure and success. So congrats, this is a successful heart attack, this is a failed heart attack. So it's really not practical and not correct and very insensitive. So what you can use is it's a completed suicide, it's a fatal suicide attempt, or it was a non-fatal suicide attempt. So someone survived a suicide attempt. So these are like, I'm not sure if I forget anything. If you can just ask me. We haven't really prepared the questions. So if I forget anything, you can always ask me and follow with follow-up questions. But these are essentially it. So if anything from this webinar, please stop saying commit suicide, start using died by suicide, ended their own life, because it's better. So yeah.
Exactly. So because words do matter and they leave like a very huge imprint, I would say. So next question, if we do not have any comments on that, okay, we're gonna move on. Just to make it like clearer for our attendees, what are the statistics about suicide in Lebanon?
Okay, so I'm gonna talk worldwide first. So worldwide, it's each 40 seconds, according to WHO, one person dies by suicide, and it's estimated that when each person dies by suicide, each 40 seconds, 20 have attempted. So it's really a huge number. In Lebanon, we have estimates. Essentially, we have one death every 2 days. And this is still an underestimate. I'm going to talk in a few why. And one attempt each 6 hours. So one death in 2 days, and this is an underestimate because you can imagine yourself, we have like more than 180, about 180 deaths per year from suicide. And there's a saying in suicide prevention that one death by suicide is an extra death. So each death counts. It's not just numbers. So it's an underestimate because when someone dies by suicide, it's really stigmatized topic. It's really a taboo topic. So everyone like hushes it up. They put like cause of death. So our statistics essentially come from Embrace Lebanon and the ISF. So using these national statistics, and the ISF, they use the death certificates, and most families on the death certificates, they would change the cause of death. So they won't say died by suicide. So they would put something else. And this would really impact the estimation. But so far in Lebanon, we are one of the lowest, we have the lowest number of suicide, one of the lowest numbers of suicide in the world compared to other countries. And this may be due to first stigma and the underestimation, but it also may be due to some protective factors like religion and so on, and other factors that haven't been really well studied, essentially. But and we have also one of the few, probably the only Arab, I think, country that we have a mental health program in the ministry dedicated for suicide prevention too. So that's an extra thing. For suicide in general, by the way, if I may add, that usually females attempt more than males, but male die by suicide more than females. And this is usually due to the means used. So usually males would use more, let's say, harsher means. So guns and so on. So maybe asphyxiation. So these are really means that one would not really يلحق, won't be able to go to the hospital as soon as possible, won't be easily saved, while women tend to use stuff more like pills and so on. So this is why they attempt more, but they do not die more of suicide. So this is like in a nutshell about statistics.
Yes, that's really interesting. So from that, we're gonna go to the next question. And this question is about, like, generally, what are the risk factors for suicide? What could lead someone to think about or to try to end his or her own life?
Okay, so first, recent research have shown that the risk factors for having suicidal ideations are a bit different than actually proceeding to the act of trying to hurt yourself. But I'm not gonna too much separate them. But one of the major risk factors of attempting suicide is having attempted suicide before. So once someone breaks this glass ceiling, essentially, it becomes easier. So if someone has a previous attempt, they're more likely to attempt another time. This is a common misconception that some people just attempt once and they will never attempt. It's actually the opposite. It's the highest risk, especially if that attempt was within 3 months, within one year. The closer it is in time, the more dangerous it is. There's also multiple other risk factors. So having imagined your death, for example, or what happens after you die. Self-harm is a typical example. Also, even so, self-harm, I'm saying like non-suicidal self-harm. So actually hurting yourself without the intent of killing yourself. It's also a risk factor for suicide because essentially it increases the pain threshold. So people who also are more sort of adapt to pain, have a higher pain threshold, these people are more likely to attempt suicide. Okay. There's also impulsivity. So impulsivity, you can see that clearly. It's one of the huge risk factors. Am I lagging, Rana? Are you listening to me?
I don't know if it's my connection or yours, but someone of us is lagging. So I think it's you. Can you hear us well?
Did I lag a lot?
Is it me or Alfred? I heard most of what you said, but I just want to make sure if they could hear it or
Amazing,
or
it's Rana.
Okay, perfect. No problem.
I'm glad. If it's you, I'm glad. So,
okay.
I was saying about impulsivity. So yes, this is why it's one of the huge risk factors. Impulsivity, in a nutshell, is like going for short-term reward instead of long-term reward. And you can clearly see how impulsivity usually it plays a role, for example, in bipolar disorder. Well, one of the typical symptoms in bipolar disorder is impulsivity, and that's why people who have bipolar disorder are at huge risk of suicide. So about 25 to 50% of them attempt suicide, while as much as I think 10 or 20 succeed, which is a wrong way to say succeed. So as much as 10 to 20% die by suicide. So essentially that's it, I think. And there's like multiple risk factors, socioeconomic, all the mental health risk factors, because essentially everyone who dies by 90% of people who die by suicide have a diagnosable mental health disorder. So having a psychopathology in itself is a sort of a huge risk factor. So yeah.
Okay, so does anyone have anything to add or say before moving to the next question? Okay, I think we do not have. So this is a very interesting question because almost around a huge audience of Lamsas is medical students. And I really want to ask about this just to highlight it more. Are we as medical students at a higher risk of attempting suicide, or like, is it being a medical student, is it a risk factor for suicide?
Yes, being a healthcare student, being a healthcare professional, there's a higher risk of attempting suicide, not just because of the long hours, and all of that, the burnout, the mental health disorders. These are in themselves risk factors, but usually we have other stuff because of our work. So you have first, one of the huge thing is the low threshold to pain, the low threshold to emotional pain. So you see patients dying every day. Death, you're being exposed to death multiple times. This is increases the risk. You feel like death is something less of a big deal. We're more desensitized to death. You're more desensitized to emotional pain. So this is a huge risk factor, especially in attempting. There's also the pressure, the societal pressure. Like for now in Corona, heroes, you are heroes, you are so on. It puts a lot of unintended pressure, but this pressure is real and it's really dangerous. There's also being a professional in itself, so الهيبة, professionalism, and so you're not, sometimes if you cry that because your patient died, this might show as unprofessional, so you keep it in. So there is really this very distinct mix of factors in healthcare students, which makes them really feel vulnerable. Yes, essentially that's it.
Yeah, I can what you're saying, and I know it's one. So I just want to add this as a message. We always think that we're more protected because we know about the disease itself, or about the medication, or about what's happening in general in the human body, but actually we're the most at risk. So it's very important and very essential for us to protect our mental health and everything that عرسنا خايمة. I don't know how to say it in English. So just protect your mental health as much as you can. And we'll move to the next question from here. And this is basically the most essential part of our discussion today, because as you said before, suicide is counted as death, but actually it's a preventable death. So what are the strategies, or how can we prevent suicide in general?
Maybe before talking about suicide prevention, let's talk about a very famous theory of suicide, why suicide happens essentially. So I'm not sure if any of you is familiar with the interpersonal model of suicide. So essentially, it says that people who attempt suicide are people who want to die. I'm gonna go back to this, want to die, and those who can't. So those who want to attempt suicide, essentially, not want to die. So those who want to attempt suicide and those who can't. So it says that those who want to are people who feel a burden to other people. So there's this perceived burdenness, the burden to other people. Their existence is less significant than their death. Their death is more important, and this is how they think about it. The other thing is also failed belongingness. So what's belongingness? I don't know what the word is. So feeling that they don't belong in their society, feeling that they're alone, feeling that nobody understands them. So these grosso modo, these factors. So feeling like a burden to other people and feeling that you don't belong. So this is those who want to attempt suicide, and having access to means and acceptable means usually. So a knife, a gun, etc., depending on what's acceptable to the person. And when these two come together, this is like the highest risk to someone to attempt suicide. And this is usually a famous model for how suicide happens. And parenthesis, I want to talk about a very famous myth and a very huge myth. It's called that it says that people who attempt suicide or who die by suicide want to die. Okay, and this is very, very, very much wrong. Usually, we're literally built to survive. Evolutionarily, we evolved to survive. This is what we do. So for a person to be able to actually hurt themselves to the point of death and to the point of danger, this takes a lot against the human nature. It takes a lot of effort against the human nature. And this is where we say that people who attempt suicide do not really want to die, but more they want to end the pain. So the pain is so unimaginable, so they cannot perceive living with this pain, that the idea of death is really far better than the idea of living. And so people who attempt suicide really want to end the pain and don't want to die. So having said that, strategies can be implemented through multiple places, so multiple facets. So suicide is very complex, but even if it's complex, that's a good thing, because you have multiple ways to kind of prevent it. So if you remember from the model, so those who want to and those who can't. So essentially, those who can, those who have access to means. So one of the strategies and policies that could be implemented is essentially controlling the means. So, for example, gun control. Sort of like these dangerous detergents and the mall. So you need to control the means. So by controlling the means, this is a huge suicide preventative strategy. Even in people who have attempted suicide and are at risk of attempting again, or those who want to attempt, one of the huge things you can do is remove the means from their access. So when you do that, the risk plummets a lot, because the highest risk is being close to the means of how you're gonna essentially kill yourself. Other strategies involve the regular mental health strategies. So integrating mental health in primary healthcare, having trained professionals in suicide prevention. There's like those, again, psychopathology, mental illnesses, people who are living with mental health disorders. Those are the people that are at huge risk, and those are the people that need to be helped in a sense, not in a sense to prevent suicide in them. There's also something called gatekeeper training. So teachers, people who are in the community, that parents, people who are in the community that are essentially in contact with the other community. We teach them how to recognize signs and warning signs of suicide, like isolating yourself, like talking more about death, writing will, having having death wishes, and so on. So to recognize these signs in order to help the people seek help. So this is called gatekeeper training. And of course, at the top of the pyramid is having actual affordable and confidential mental health services, having an acute crisis team management, so an acute hotlines, for example. So our famous Embrace Lebanon hotline 1564, it really does the job. But this is like the top of the pyramid. The bottom starts with prevention. People are suicidal, emotionally stressed, called the lifeline. But you want to prevent that further by gun control, by mental health initiatives. So this is kind of it.
Thank you so much. So that's why we should always talk about suicide prevention, because it's, as we said before, it's a death that we can prevent, and we as healthcare professionals love to prevent deaths, so we have to know about this. But I want to dig deeper into this topic, and I want to ask you this question because, as we said before, we're more at risk. So what can someone do if he himself is having any suicidal ideations? So if I thought about suicide, what should I do?
Okay. So first, realize that it's very common to someone to think about suicide, ideation, having ideations. So most people think that this is something, especially in our society, people think that this is something that only them, only they experience and nobody else experiences. So this is why Embrace's motto is "Talking saves lives." It has really huge facets, but one of them is like when you talk about suicide, when you normalize talking about suicide, it does not, there's a myth that it plants the idea in the other person. It does not plant the idea in the other person. So blacks, the person feels that for you, suicide is not a taboo. So people start talking, they're more likely to talk with you about suicide, and they're more likely to seek help and understand what's happening. And this is how talking saves lives, essentially. So, and one of the things, I'm gonna go back to the prevention. I forgot one very important thing before I answer this question. So one of the huge preventions is also media, important to talk about suicide with our peers and so on. But sometimes media portrays suicide in a huge manner that might create a suicide contagion. So suicide is actually contagious. So it's not because, so for example, if the media reports suicide in a wrong way. So for example, saying that the person died, it happens a lot in Lebanon. The person died, burned himself because he couldn't feed his child. Okay, so
needs
this, yeah, so
yeah.
this is one factor. This is one factor in a whole complexity of factors, not being able to support your family. But suicide does not happen just because of that. It's really a multitude of factors. And then the media goes on to show how the person killed themselves. Burning, knife, gun, etc. They give you more and more suggestions. And for the people who are already suicidal and not the people who do not have suicide ideation at all. Again, talking about suicide does not plant suicide ideations. This is wrong. But people who have suicide ideation, seeing that people have died for this, especially they have died and became kind of romanticized and make them heroes that they killed themselves. So no, he killed himself in front of the ministry to protest. Yeah. This is heavy. This is painful. This is not heroic. This is not. We shouldn't romanticize this. This is painful. Someone is so in pain due to lack of basic needs, lack of multiple other stuff, and going through a lot, not just one factor, that they burn themselves alive, which is very, very painful. So other people will romanticize this idea, and they might be suggested more if they have suicidal ideations already to actually attempt more suicide. And this is where responsible media reporting happens. Okay, so this is aside. Now to answer your question.
Really, because it really happens a lot in our media. We do not have the awareness about mental health in general and about suicide in specific. So reporting mental health incidents or suicide attempts are always edited in a very bad way. And like
this knowing that Embrace works on this, but usually most media outlets do not care. They really do not care. You can actually see sometimes.
I was saying that the scope itself is much more important than what it could have as damage or what it could be,
Exactly.
it could do.
This
yeah.
group is more important than multiple other lives that could be lost. So
Yeah.
think about that.
What?
So if I have suicidal ideation, okay, the short answer is seek help, but the long answer is way more complex. So again, many of us experience suicidal ideations. It's really important to talk with someone. Okay, so if someone you trust, someone that won't judge you, so talk to them, tell them that I'm feeling this and this. And we have two types of suicide ideation. We have passive and active. So this is very important risk-wise. So passive, which many people have, especially in this situation. So I wish I was dead. I wish someone would kill me. I wish I didn't exist. So these are passive suicide ideations. But active suicide ideations are more like, I want to kill them. I want to kill myself. So it's active. I want to kill myself. I want to do that. I want to jump off a building and so on. This is active suicide ideation. And when you have active suicide ideation, also active or passive, talk about it with someone. You can always reach out to Embrace. They're fully confidential. They're fully trained to handle this. 1564. You do not even have to give your name. You can give an alias. So really talking saves lives. Talk about it. Talk about it with your friend. Talk with someone who understands, because when you talk, first thing, the burden on your shoulders will lift. And the second thing is that you might actually talk through it until you find a solution, until you find what you're going to do next. So this is very important. Now, if you have, it's always a good idea to contact Embrace. It's always a good idea to seek help. So usually people have suicidal ideations, especially if they're not just small, for short durations, not just an idea that goes and comes. It's more than that. It's really advisable to seek mental health professionals, whether a psychiatrist or a psychotherapist, because as we said, 90% of people who attempt suicide have mental health disorders. So it's really good, especially in this situation we're living in. But I urge someone who has active suicide ideations, like this is a red flag. At any point, if you have an active suicide ideation, please talk to someone. Please talk to Embrace. I think the next question is about how we can help other people. We can cover. I'm going to cover that, but talk to someone and go seek help, because it's very essential. It's not just you who's going through it, but you deserve the care of the world. You don't, I just, this is very speechless to me. No, please go seek help.
If we go back to the same analogy that you gave before, so if you're in physical pain, you would directly go and seek a physician to help you to relieve this pain, or just tell you what to do. And this is the same thing. So having suicidal ideations come from physical/psychological pain that might be unbearable to you, and that you need to share it with someone, to reduce the burden. So just go and seek help, and always remember that Embrace, we're gonna send the number in chat, and we're gonna add it also. You can always seek help. You can always call them. They're always available. Currently not 24/7, but soon to be, I hope so. And we'll move to the next question if no one has any other.
I want to add something. Yes, that please seek. Many people have bad experiences with psychotherapists, psychiatrists, etc. So first things first is to seek actually a psychotherapist that is licensed and trained and licensed by the Ministry of Public Health in Lebanon, and not just so it's not any psychologist, not a three-year major makes you a psychotherapist. Psychotherapists take long trainings. They have 400 hours trainings. they have masters and so on. So please make sure the psychotherapist is licensed. As for the psychiatrist, also make sure you're comfortable with that. It's a psychiatrist, not a neurologist. So, and if you want to go to a physician, a regular physician that is not a psychiatrist, please make sure they are well mental health oriented. For example, a family medicine or so on, because unfortunately, stigma is rampant in medical the medical field. Some people would just say, stop your antidepressants and go to the beach, which actually happened once to one of my friends. So stop the antidepressant and go to the beach, because that's how you treat a medical disorder. And let's remember, mental health disorders are chronic medical disorders. They're not a walk in the park. So that's that. And if you do not like your service provider, you can always change service provider. So even if it's a licensed psychotherapist, it's a psychiatrist that all your friends have loved and they have benefit from. If you're not comfortable, you can always change. Okay, so this is very important.
Important. So basically, we're gonna move to the next question, because it might happen, and it happened to me multiple times, and I would love. Yes, can you hear me? Am I lagging? So is it me? It's me.
Rana, we can hear you.
Okay, so you're lagging. Okay. So we're gonna wait a bit until he connects back. If you have any question, guys, feel free to ask it. We would love to hear your questions. Okay, I think Alfred is out.
Sorry again.
No problem. I'm happy that this is you this time. It's not me, it's you.
Okay. I'm not.
Okay, so what I wanted to say, or what I wanted to ask actually, is that due to it might be because we have friends, it might be because we're healthcare providers, or anyone could approach us saying, it could be a very dear friend, a friend that we know, or it could be family sometimes. So they can approach us and say, I have these ideas in my mind, I do not know what to do about them. How can you help me, or help me please? What should we do?
Step one, don't be a typical Lebanese. So step one, if someone tells you they're in general, they're in distress because of they failed their class, don't tell them, okay, you can study more. Don't jump to problem solving. So, which is something we typically do with our friends. So, hello, I'm stressed because of problem A. Here you go. This is your solution. Probably the person knows the solution. They can come up with their own solutions. It's not something they're talking to you because they want to be heard. So, first thing is to actively listen to them. So, to actually understand them, empathize with them, make sure you care, you understand. Okay, understand you. I know how you're feeling. You're feeling stuck, etc. So care about them, understand them. Do not care about the solution. Okay, give them time to and listen to them. This is the very first important step. When someone asks you about suicidal ideations, specifically, make sure to ask if they have a method in mind. This is in a nutshell, and there's huge things to say to cover, but I won't cover them here. But make sure to ask if there's a method in mind, if they have thought of a method. If they have, make sure that the person is away from that method, or if they have a plan or time or a place to do so. You encourage them to call Lifeline to seek help from a professional. So you can always yourself call the Lifeline and ask for guidance. They would help you, essentially give you a mini training on how to deal with this stuff. And one of the most important things, very, very important things, after you listen to them, after you see if they're in a very real danger, if there's a method, you keep them away from the method, is to make a safety plan. So a safety plan has been shown to reduce suicide by about 45%, if done well and if done empathetically and collaboratively with the person. So a trick to memorize safety plan is the 3 P's: person, people, and place. So you ask the person, to write on a piece of paper or on their note what warning signs when they feel suicidal or they're gonna start feeling highly suicidal. What are the usual warning signs they feel? So do they feel like they don't want to talk to anyone? Do they feel like they don't want to reply to their WhatsApp messages ever again? Do they feel like they want to just eat everything inside? So what are the warning signs, okay, of these suicide ideations? And this is very important to recognize. So when a person, okay, I'm doing that, this might be me going into a sort of suicide, having more suicidal ideations, okay? And then how to deal with them. So the first one is person. So how does the person usually cope with their internal coping mechanisms, from watching series, watching TV, distracting yourself with something? How do they usually de-stress? It's very important. The second thing, it's always advisable to put 3 numbers of people they trust. Usually the third number is 1564, the lifeline number or whatever it is in each country. But the first 2 numbers would be a close friend, maybe you, because they trusted you in saying that they're suicidal. And when they feel that so suicidal, they can call you to talk about it. And the third thing is place, a safe place. So it can be real, it can be imaginary. So where do you go for and somewhere away from the means, of course. So remember, means confer the highest risk of attempted suicide. So maybe some people would say, I want to go out to the balcony, drink coffee, and listen to Fairuz when I'm suicidal. That can do. Some people will just say there's no place, so they would close their eyes and imagine themselves at the beach. So these might sound trivial and small, but these go a long way. Okay, these go a long way. And when usually you listen to the person talking again, I'm copywriting embrace here. It saves lives. So when you talk about it, the person will feel much more the balloon of emotions will go out, and the person will think more. So the emotional phase will go out and the cognitive phase will come through, and person will come up with their own solutions, will do everything. Just they need someone to listen to. So if they're crying, stay with them. It's okay to cry. Okay, so this is like in a nutshell. Especially take care of your friends. I know healthcare professionals take care of their friends and the healthcare professionals. We like to burn ourselves. We are more prone to burn out. They burn us out, but sometimes we want to burn ourselves out extra. So make sure we don't do that. Self-care is healthcare. So yeah.
Yeah. So that was a very good answer. Actually, I wanted to add something that I know sometimes when someone comes to us saying that I want to kill myself or I have these ideations, and especially if we're not trained to deal with that, we will feel a bit under pressure. We will feel a huge emotion. We might be always scared about this person. We might always want to go back and see what happened to them. But as Alfred said, it's always you that is essential. So you can never help anyone if you didn't help yourself first. You can never make anyone feel better if you're not feeling better yourself. So always take care of yourself. Always remember that you're the center of it, and always remember the number of the lifeline, because someone around you might need it one day, and it's easily reachable. So I want to thank you. for that. And I want to ask you now, it's your turn now, no question asked. So if you want to add anything about the topic, the floor is yours.
So I just want to say, please, I know it's like everyone that grows up in Lebanon, you are brain 140. It's the Red Cross, which are amazing people. But Embrace should also please remember that number 1564. They're also amazing people. And these are, so if someone is having a panic attack, someone you know is having a panic, if you're having a panic attack, it's not, you don't have just to be suicidal. If you're depressed, if you're sad, if you're going through a lot, if you're anxious, if you're suicidal, this number is there for you. Okay, so please reach out, especially healthcare professionals. And if you are a healthcare professional, I want to add something very important. So I've recently started my internship at the hospital, and I'm I sometimes I'm pissed daily because of how little we care about the mental health of our patients at the hospital. Sometimes we, please remember that psychological stress and psychiatric disorders are very common in hospital settings, and sometimes the patient is doing well, but they need someone for you to listen to them. Sometimes the people are depressed, so you need to at least dig a bit into that. So and this, I want to share this story of a person who came at the hospital for a regular lab chole, a regular lab chole, and I felt she was a bit down. So usually, as we were trained, we care about our patients, but people are not usually trained or know how to do this. They don't usually know how to do it. So me being trained in all of this, I just wanted to see, and why is this person sad? And it's just a lab chole. So I asked her, and it turns out that and I dig deeper and I talked to her, and it turns out she hasn't been herself since the explosion, the August 4th explosion. And she feels depressed since then. She feels she cannot, and she's having a lot of psychological symptoms and possible psychiatric illness, but no one cares. She's coming for a lab chole. Okay, so I ended up giving her the lifeline. I made sure she wrote it down. She wrote the number on her phone, because small thing, you don't have to do a full assessment, psychological, psychiatric assessment. Just ask the patient, بدل كيف ليلتك? How was your day, stay at the hospital yesterday? Also ask them, how are you feeling today? Just this simple. And don't be afraid of emotions. In this, especially men, don't be afraid of emotions. They're very powerful tools. So I wanted just to add that. And now I'm hoping أنا عملتش. Okay.
Okay, so before leaving the session, I know that there is something that you would like to share, and I would really love you to share it. So
Okay, so
I don't know if you can hear me.
I can.
Okay, I can see it.
Okay, so this is a psychoeducation booklet that essentially this is me and my colleagues when I was a mental health coordinator at Lamsa. So we created this booklet in collaboration with Embrace. So you can scan the QR code. You have really like it's a small digital booklet you can download. It has most of the mental health disorders, psychoeducation stuff about mental health. So it's like mental health 101. This could help you in learning more about mental health and advocacy. All the info there are cleared by Embrace. So we work together with Embrace on this, and it's really a very interesting tool, and I hope you like it. So do scan it and let me know. And Rana went. So anyone has a questions or anything? Anyone? Well, it's good, amazing. So Layla, essentially, this is a QR code. So you put your phone camera, if you have an iPhone. If you don't have an iPhone, I'm not sure, you need to download some QR reader, and you scan the codes. I think I'm gonna try and send the link also on the chat, and you can download. Maybe Rana, you could send the link later on your Lamsa group types. Would that be an option? Rana, you're roboting. I don't know what you did.
So on Lamsa's group, I'm not sure if you can hear me. I would link this booklet on Lamsa's group if you can hear me. I think so.
So then up. I really want to thank Lamsa and Rana so much for the invite. It was a pleasure. And I'm not sure what to do right now since Rana is okay. Serena?
Okay, I will stop recording. Thank you very much, Alfred.
Thank you so much.